I think, having been responsible for health and social care, that some of the cuts in social care did go too far.
Research published today by the NHS Confederation, which represents senior NHS staff, suggests the health service is having to cover the cost of inadequate funding for social care, and it's calculated that spending on social care should rise by at least 3.9% year on year. The health leaders are meeting for a conference in Manchester today, and our reporter Samantha Fenwick was there.
I'm in the centre of the conference hall where people from across the UK in the NHS and social care have come to discuss the future of the sector. Now, earlier in the year, the government set out a plan, a strategy for how the NHS should be run in the next 10 years, and they allocated an extra £20 billion in additional funding. But the report out today suggests that that plan could fail without more money being put into social care. Social care is a massive strain on the NHS. Now, Niall Dickson is with me. He's from the NHS Confederation. First of all, Neil, why is social care such a strain on the NHS?
Well, we tend to think of health and social care, if you're in the industry, as being two separate things. But of course, for people who are actually receiving social care, they don't make this distinction at all, whether it's a social care bath or a health bath. It really doesn't matter. And the reality is that as social care has been drastically cut to the absolute bone, it means more and more people are not getting access to those kind of supports for daily living. The effect of that is that more people end up coming to the NHS, being referred into NHS hospitals when in fact they could be better looked after in their own homes, and they get stuck in NHS hospitals because they can't get out because there are no facilities to enable them to leave.
Well, there's also a staffing crisis in social care. Research done for you and yours suggests that we need an additional 1.2 million carers in the next 15